the lightning strike moment of horny feelings that we tend to see in our culture, right? That's what we see represented around us almost always in the movies and the shows we watch and the books we read. How can we get comfortable and even embrace pleasure, right? When many of us are taught from a pretty young age that that's a bad and dirty thing.
Absolutely. And I think even that concept of expressing needs can come into play there. If we're someone who struggles to express needs generally in our life and our relationship, then it can be incredibly difficult to do so in a sexual context.
You're going to have differences, and so it is likely to have differences whether it's around organization, timeliness, parenting, and sexually.
If you had a magic wand and could impart one piece of knowledge or skill on all humans, what would it be?
And the thing that comes to my mind is
If I could kind of wave the magic wand, right, it would be
Today I'm joined by two incredible experts whose work has helped reshape the way we understand sexual desire and relationships. Dr. Lauren Fogle-Mercy is a licensed psychologist, ASEX certified sex therapist, and certified emotionally focused couples therapist. She's known for her compassionate, inclusive approach to sexual and relational wellness and for making complex topics feel accessible and validating. Dr. Jennifer Wenzel is also a licensed psychologist and ASEX certified sex therapist. She's a researcher, clinician, and assistant professor who specializes in sexual health, intimacy, and sex-positive affirming care. Together, Lauren and Jennifer are the authors of Desire, an inclusive guide to navigating libido differences in relationships. In today's conversation, we explore some of the most powerful insights from their work and share how couples can use their evidence-based practical tools to understand and navigate desire differences. I know many people listening will fall into either one of two camps. So they'll either want more sex with their partner or they'll be experiencing low sexual desire. Why is this mismatch of desire so common in couples? And what is it that we get wrong about the way that desire works?
I think that it's like any other area of a relationship. You have two or more people, you're going to have differences, and that's just natural to find in partnership. And I think there is this myth or this assumption that in sex it should be different, that things should just match. And you hear it even in the language that we use around like mismatched desire, as if like matched is the thing, you know? But it's just like any other area of a relationship. You're going to have differences. And so it is likely to have differences, whether it's around organization, timeliness, parenting, and sexually. So it's the norm rather than the exception to have desire differences. I think the biggest thing is that people don't know that or anticipate that, and then they get really thrown off when they experience it.
I think that's so important because also I think I'm sure you've experienced this clinically where people come to you and sort of say, our desire doesn't match up. Does that mean our relationship isn't going to work? And the reality is that we know that every relationship will have mismatches, will have differences. So I think that concept in itself is just so important to highlight. One of the things I found that, in the book and in my own work clinically with clients that they've has been really helpful for them in understanding some of these differences is that concept of responsive and spontaneous desire. Can you explain a little bit more about what that concept means?
Yeah. So we know that there are two different styles or two different types of libido, aka sexual desire. And that is perhaps one of the things that we get wrong socioculturally about libido and quote unquote matching desire, right? That there are different styles and different types. And it's not uncommon for partners to have different styles or types that they need to navigate. So they kind of sound like what they are. Spontaneous libido is that, I think about it as the lightning bolt moment, right? We're horny, we're aroused, it's sort of striking you all of a sudden. It may or may not be obvious what kind of caused those sexual arousal type of feelings, but it just kind of shows up there, right? Responsive desire, on the other hand, really takes more time to build, right? And we think about that much more as kind of a 1-2 step process, right? The body needs to get aroused in some way first, right? There needs to be some sort of pleasurable stimuli happening. And then the brain kind of responds to that physiological arousal oftentimes, right? So much more of a intentional process. Oftentimes it has to be a much more intentional process as opposed to the lightning strike moment of horny feelings that we tend to see in our culture, right? That's what we see represented around us almost always in the movies and the shows we watch and the books we read. It is that spontaneous libido. And so it makes sense that A, people don't know that there are different styles of libido. And B, if they're not super spontaneous or maybe have never been very spontaneous, that they're kind of looking at that media and our culture and saying, well, that's not me. What's wrong with me?
That's so important because I think that you're right. That's what we see on TV. That's what we see in movies is that people are immediately in that state of desire where they're ready to go, they're ready to jump on each other. But it's quite often not reality. And I think when people understand that, one of the things I've found is that people feel like if it doesn't just automatically switch on, there's something wrong with me and I don't have desire. Whereas responsive desire really opens up that pathway to seeing that you do have desire. There's just some things that we need to do to get there. Can you explain that model or that concept really around with responsive desire, the handbrake and the accelerator?
Yeah, we saw this popularized by Emily Nagoski in her book Come As You Are, but it's actually an older research concept about the dual control model that essentially we sort of liken our sexuality to a car with an accelerator and a brake pedal, and that there's a whole bunch of things that can hit the brakes for us, and there's a whole bunch of things that can hit the accelerator, and the sensitivity of those systems is going to vary by individual. And so some people might have a really sensitive accelerator, meaning that it doesn't take very much or it's very quick to get turned on. And lots of people might have a more sensitive brake system, which means that maybe it doesn't take a lot or it's very quick to hit that system's brakes. And so often when we are working with folks who have more responsive desire, we're looking at the myriad of things that might be hitting the brakes and exploring how we can maneuver some of those things. Some might be things that we just sort of learn to work around, and some might be things that we can actually remove or improve.
It's so important to understand that, and one of the things that you talked about in the book that I think is also so important to understand is this concept that if we always have that handbrake on, so whether we're putting the accelerator on super fast, if we have that handbrake on, we're not going anywhere. And I think you were talking about that idea in the context of, when we go on holiday and we're in a nice, we are just talking about weather before, nice hot place, and, we're feeling like we should just arrive there and everything should be ready to go. But if we still have left that handbrake on, then we're not going to go anywhere. So, one of the things that you talk about in the book is those key foundations that we need for responsive desire to be present. Can you unpack those four key concepts for us?
Sure. Yeah. Like you said, there's four general factors that we talk about that really have to be in place for responsive libido to have a chance to thrive. Briefly, those are consent, pleasure, focus, and time, right? So, the way I often talk about this with patients or clients is that first and foremost, because we know responsive libido takes a bit more time to get into, right? There has to be an intentional kind of willingness. There has to be that consent process getting into the experience, right? If we're going to try to get some bodily arousal going so then our mind can respond and we have that responsive desire, we have to first be willing to engage in the touch, for example, right? The cuddling with our partner, the physical pleasure, hopefully that's going to happen, right? And this can be a sticking point for a lot of folks who are really looking for that spontaneous libido moment to get started with things, right? So if they're just waiting for that lightning bolt moment of spontaneous libido to even start engaging with their partner, that's going to be a difficult process, right? So with that consent process, we think about that in much more of a broad way. Oftentimes when I say that word to patients, they're thinking, oh, well, this is not sexual assault with my partner. And I'm saying, yeah, and I think we can all agree that you're probably not going to have responsive libido or responsive desire if it's an assault situation, right? But we actually mean that term in a much more broad way. Are you willing to engage, genuinely willing to engage, not because you're feeling turned on in that moment yet, right? But because you're willing to start trying something physical with your partner to see if we can get that response going. So that's the foundation. Number one, everything needs to be consensual in kind of the full scope and meaning of that word. The experience itself has to be pleasurable, right? So if you are genuinely willing to engage with your partner and you're saying, yep, okay, like let's try some touching, see what happens, see if we can get that responsive desire going. And the touch is painful, or even if it's just neutral, right? So, say rubbing my elbow, you're like, well, it's fine. It's not bad. It's not great. It's just my elbow, right? that's not gonna be enough pleasurable touch, pleasurable sensation to get us to a responsive libido experience, right? So those are the first 2. The third one is focus. You could be very willing, very consenting to engage in an experience with your partner. It could be very physically pleasurable, right? You're engaging in some touch with them. But if your brain is somewhere else, if you're thinking about the noise down the hall, the kids, right, that are underneath your bedroom, the thing you have to do for work tomorrow, right? If you're not in the moment experiencing that pleasurable touch when it's happening, it's going to be really difficult, if not impossible, to get responsive libido going, or at least going quickly. And of course, the fourth one is time. Again, all 3 of those factors might be in play, right? We could be genuinely consenting and willing to engage with our partner. The touch could be very pleasurable. We could be very focused. But if that's only happening for 45 seconds, right, it's generally not enough time to build the response, right? So that time factor might vary. Sometimes it might happen in a minute. Sometimes it might take 10, 15, 20 minutes for that to happen. It depends on how those factors interact.
Mm, they're all so important, and I want to unpack them all a little bit more because there's so much in each of them. But just thinking about that idea of focus, have you noticed that becoming more of an issue in your practice? Because I think just globally, we are more disconnected. We are more on our phones. We're struggling to be more present in the moment. I'm just wondering if you've noticed that in the work that you're doing.
Yeah, I think, most of us are um, multitasking. We're focusing on a lot of different things. We're in our heads throughout most of our day. And so it takes a lot of sort of slowing down and intentional practice to facilitate embodiment and present focus and, kind of noticing what your surroundings are. And so I think that is getting harder for many of us through sort of the digital modern world. And I also noticed a trend, and I don't know, I mean, it would certainly fit with some of the research about the effects of mindfulness on sexual health, that a lot of the people I work with who have more predominantly responsive desire struggle to be present in the moment. And that just makes a lot of sense as to how that can, create a barrier to pleasure and to really experiencing sex in a similar way to maybe somebody who doesn't have that same barrier. I see a lot of the time my more, spontaneous folks that I work with, they can shut off the world and they can just go into this sort of flow state with, just being in the moment and everything sort of melts into the background. And so focus becomes a really important part of our work with our clients and sex therapy, and just for people out there who are more responsive in nature. I think this is a really key element.
Absolutely. And I've also noticed with people who are more responsive in nature, doesn't mean that they always are the person who's carrying the mental load, but sometimes that really trips them up as well, as they're very stuck in their head. So they have that kind of to-do list going on and they're really struggling with being present in the moment. And that can also be, I think, a career thing I've seen as well. So when people are very focused on their career, they've got their kind of to-do list, going into their house, and then they're not connecting in the moment with their partner. They're still in their head. So, whatever it may be, when we've got things ticking over and we're not present in the moment, as you said, it's really hard to connect with that pleasure, and that's where mindfulness can become really helpful. I also want to unpack that idea of consent because I know you would have experienced this and I experienced this in my work, and people listening will definitely be familiar with this concept of whether you are the partner who's experiencing high desire and you're looking to initiate intimacy with your partner, but you're worried about that idea of pressuring them. So you don't want to pressure your partner. You don't want them to feel like this is something that they have to do, but you don't really know how to approach the conversation. And then equally for the person who is experiencing low desire, there can be this sense of, I just don't know how to get there or if that is even possible. And I think just hearing that idea of responsive desire and what we need to create the foundations for responsive desire is starting to think, oh, okay, like, yes, this is a possibility. There's just a context here that's required. But this idea of willingness, I think, really helps couples to shift into a different space around where and how we can start to initiate things. So, can you unpack that willingness model for us?
Yeah, this is rooted in Joanne Leland's work from back in the 70s. It's been a while that she really wrote and was publishing on some really groundbreaking ideas. And the willingness model and that concept was one of them. Lauren and I have really kind of taken this as a potential intervention, both kind of a self assessment, but also a partner communication tool that we can use. So we think about the willingness scale as a 0 to 10 spectrum, right? The idea being, I'm not having spontaneous kind of horny libido feelings in this moment, right? So if my partner's initiating, the answer is probably no, I'm not really feeling that way. But 0 to 10, right? Zero being nope, not a chance, not willing to even try to get responsive desire going. Definitely no to 9 or 10 on that spectrum, on that scale being, yeah, I'm still not having spontaneous libido in this moment, but I feel like we can engage in pleasurable experiences, touch together. I know that I can be focused or use my good mindfulness skills that I'm learning in therapy to do so. I know that we have time and privacy, right? So, yeah, I think I can get to a 9 or 10 and be willing to engage in this way. This is where our brakes and accelerators and knowing what they are for us becomes really important, right? Handbrakes being the thing that kind of move us closer to zero on that willingness scale, right? The things that, are stressful for us that kind of shut us down from both willingness to try to have responsive libido, but spontaneous libido as well. Accelerators, gas pedals being the thing that move us closer to willingness, right? That help us decide, okay, yeah, I think that this could be a good context and a good environment for me to try to build that responsive desire. And what is potentially tricky about brakes and accelerators are that one person's brake can be another person's accelerator. So it's really important to have some good self reflection around what those are for you and some good conversation and communication with your partner about what their brakes and accelerators are and how we might have some similarities and some differences.
Mhm. It's so important. I think it just really changes the way that we approach intimacy, doesn't it, when we consider it in that context of willingness. When partners are struggling, and obviously this will be people who are listening, with how do I start? Like, where do we start? How do we bridge that gap? What are some ways that partners can meet in the middle? And I say middle, but really we know that there is no middle. There's no middle in intimacy, there's no middle in relationships, there's no 50-50. But how do we start to get our needs met without that concept that we touched on earlier of feeling like we're pressured or pressuring our partner or resentment building?
I think of the first thing that pops in my head is the work for both partners in this dynamic. The first thing I think about for the quote unquote lower desire partner is to explore pleasure. What feels good? What kind of touch do I like? What feels nice in my body? What arouses me? What do I like? So, being able to kind of have that as the focus of some time with a partner, being curious, non judgmental, low pressure, no pressure, to really explore that together. So, that's the first thing that comes to mind for usually the more responsive desire partner. And then for the, higher desire partner, often the spontaneous desire partner, really getting curious about the underlying relational needs that are behind some of their bids for sex, because often a bid for sex is a bid for some sort of relational attention. And so getting curious about, what is motivating my reach right now? What is it that I'm sort of looking for? Because if it's just a simple sort of I say simple, but not always simple, but if it's, orgasm or just some pleasure to blow off steam or reduce stress, that is something that we can often do for ourselves on our own. It doesn't have to be a relational experience. So getting curious about what is it that I'm sort of reaching for my partner for. And often what we hear the most is to feel desired, to feel wanted, to feel validated or comforted. And so, as you get more clarity on what some of those underlying relational needs are, you might also be able to find some various ways to get some of those needs met so that it's not all bunched up in just one activity.
We know with desire, you touch on that idea of pleasure, which is so important, but sometimes they're treated separately, and I can't quite understand why, because we know obviously that pleasure and satisfaction are so connected to desire. Can you explain some of the research around that and why those 2 factors, are so essential in terms of desire?
Sure. And I think it's important just right off the bat to say that pleasure is not necessarily the same thing as orgasm for people, right? So I just want to
Yes.
make that clear from the outset, right? Pleasure can be many, many things. It might be genitally focused, it might not be, right? It depends on the person, it depends on the circumstance, it depends on the relationship and what you're into. And so thinking about pleasure in the most broad sense of what feels good to us, right? Typically in a tactile, kind of physical, sensory way. The research is pretty clear that pleasure needs to be involved for libido to happen, both spontaneous and responsive libido, right? That is why we name it as the second of our four factors that sort of have to be present for responsive libido to occur. If anything short of pleasure, right, even that kind of neutral touch that we were talking about before, if that's what's happening in an intimate experience, it's going to be really difficult to build responsive libido because neutrality doesn't sort of feed that system, right? Pleasure does.
And I think so important too when you're talking about that idea of pleasure is that that context again is really important. So again, I think there can be a misunderstanding that if we're not enjoying sex with our partner, it's not possible to have enjoyable sex with our partner, and that can obviously bring up a lot of fears for people around, is the relationship sustainable? But when we start to see that, even with things like pleasure, there is a context that we need for that. So again, those things like focus become really important. If we're not present, how can we enjoy this experience? And thinking about that idea of connectedness, like are we broadly feeling connected in our relationship? And if we're not, then maybe there's some other things that we need to address to be able to feel, safe or ready in that particular context.
I would add that in a lot of cultures, pleasure is sort of treated like a bad thing, right? So
Yes.
sociocultural influence here that deserves some airtime and a lot of times has to be addressed when we're working with individuals, partners, right, on sexual concerns overall, desire concerns in particular. If you've been told your entire life through family, through faith tradition, through cultural traditions that pleasure is bad and to be avoided, it can be really difficult to just name things that feel good to you, right? And so sometimes that process really has to be a starting point for folks that are working on many different sexual health concerns, right? How can we get comfortable and even embrace pleasure, right? When many of us are taught from a pretty young age that that's a bad and dirty thing.
Absolutely, and I think even that concept of expressing needs can come into play there. If we're someone who struggles to express needs generally in our life and our relationship, then it can be incredibly difficult to do so in a sexual context. So it may be for some people that that is the starting point, is working on expressing those needs more broadly and then bringing that in to the sexual context. You touched on that idea of earlier around the idea that pleasure does not equal orgasm. And I think even for many people, that can be a new concept because we have created a certain sexual script, or society has facilitated a certain sexual script around what sex should look like for us. And so in your book, you talk about the idea of that staircase model and the wheel of sexual experience, which I really want to start calling the wheel of pleasure. I don't know why sexual experience just sounds a bit less like exciting. Can you unpack that for our listeners? Because I think that shift can be, really eye opening for people when it comes to the concept of pleasure in their relationship.
Yeah, we talk about this a lot. Came from an old, sex therapy book or
Sex ed book.
a
Yeah.
sex ed book, I think from the '90s. And the image is just so striking when you see it, but I'll just describe the image to you instead. Um, which is just, the staircase model is just this idea of a hierarchy and an ascension of sexual activity that you do in some sort of sequence. And it reflects sort of the standard sexual script that most people have internalized as sort of what sex is. It's often focused on penetrative sex and ends in orgasm. And so it's, lower steps like touching and kissing, and then removing clothing, and then genital contact, penetrative sex of some kind, and then orgasm. And so the idea is that it's very goal oriented, that there's sort of a pass or fail nature to it, that if you don't get to the top steps or something disrupts that, that it's a failed experience or attempt. And that can also just add to a lot of the pressure that people feel, as well as this sort of all or none experience of sex, where, like,
Mm.
if we're going to have sex, if my partner says, let's have sex, all of those things are gonna be part of it, and that takes a certain amount of time and energy and interest. And, some people find orgasms to be wildly rewarding and, like, the best thing ever, and some people are pretty neutral. Some people have pain when they orgasm. So it's really sort of assumed that everybody thinks orgasms are the be all end all, and for some people they are, and for some they aren't. And so just having this idea that we can have a say of what is most pleasurable for us and how that influence our sexual experiences is really important. And yet it doesn't fit in that staircase model, which says that orgasm should be the be all end all, or that penetrative sex is the vehicle to the orgasm be all end all.
Mm.
And so the alternative model is this wheel, which is more open ended and basically says, hey, there's all these things that we could do that could be pleasurable, some more sexual, maybe some more sensual, maybe some more affectionate, and they can go in any order and it can include any parts, and it stops and starts where we decide. And so each sexual experience can then be designed by you and your partner or partners, and it can vary by experience. Today we do a little bit of this, and next time we do a little bit of that. And it takes the judgment and the hierarchy out by saying, hey, anything on this menu of options is good if you enjoy it. And no one thing is better than another. And no one thing has to lead to another. So you really get to sort of choose your own adventure.
I love that, and I think for someone listening who that can be such an eye-opening moment really when they start to realize that just because I step into that space of pleasure with my partner doesn't mean we have to go on that staircase, doesn't mean we're heading towards this arbitrary end goal. Um, it can just be that that pleasure for us is having a cuddle, that maybe normally I like to go this way down the path, but today I'm feeling like I just wanna be here. And I think it takes so much pressure off and really allows couples to start to step into that space more freely. So I think that that model is such an important concept for people to understand, to really open the opportunities for pleasure and connection in their relationship. So thank you for that.
Yeah.
For someone who's listening and is feeling quite disconnected from their desire, and, they've heard all that we've talked about and sort of it's starting to make sense for them. But I think that if this is something we've been struggling with for a very long time, we can still have a lot of thoughts and feelings around our experience of, say, for example, low desire or high desire. Can you explain to us what are some of the individual, relational, societal things that can influence desire? Because we know there are obviously so many. You might not be able to cover them all, but I just want someone who is listening to be able to connect with that and understand that there are many reasons why this may be their experience.
I'm embedded as a psychologist and a sex therapist in a medical setting. And so a lot of the clients and patients that I work with, there are very clear biomedical kind of individual level factors that are impairing often many different parts of their sexual health, including libido or desire. The biggest one by far that we see day in after day, hour after hour in our sexual health clinic is pain with sex, some sort of pelvic pain, genital pain, sexual pain of some kind. And often those are comorbid conditions that might be related to endometriosis, that might be related to pelvic floor muscle dysfunction or tension of some kind, that might be vulvodynia, right? There are many different, unfortunately, pain conditions that can impact sexual health and the genital area of the body. And so I often will say to patients, it makes good, rational, logical sense that you don't super feel excited to do something that's gonna hurt you. That's a
Mm.
survival instinct. That's a normal, rational response of your brain trying to keep you safe, right? Our brain doesn't say to us, "Definitely go put your hand on that hot stove. That's gonna feel great," right? That's not how our brains work. That's not how our nervous system works to protect us and to sustain our life, right? And so normalizing for folks that if you're having pain with sex, it makes sense that your libido is not that great, spontaneous and or responsive libido. And so we have to first and foremost start with addressing the pain, assessing the pain, treating the pain, eliminating it as much as possible.
And I think something that people may not realize is that change is possible with that. Can you explain just with that one key problem that people might be facing, what are some of the things or what are some of the treatments or the things that are options that are available to them around pain?
Yeah. So, of course, it depends on the diagnosis, right? But generally speaking, there could be medications, topical oral medications. Often, pelvic floor, physical or occupational therapy becomes a big part of treatment. Regardless of where pain started, oftentimes our pelvic floor muscles will start to clench over time. Certainly, a lot of the folks I work with have endometriosis. So, looking at treatment options for that, which might include surgical excision. But even with endo, right, like if you have had a lot of inflammation over time, those pelvic floor muscles often will start to clench more consistently, more chronically. And so it's not just treating the endometriosis at that point, it's then pelvic floor physical therapy to get the muscles in a healthier place. And of course, this is hopefully happening alongside a behavioral health, a mental health provider, maybe a sex therapy provider to help kind of reestablish trust, safety, and pleasure with intimacy when unfortunately, a lot of people push through painful sex for a great deal of time before they're appropriately diagnosed and treated for the pain condition that they have.
Mm. One of the things I love that you do throughout the book is I can't remember the exact terminology you use, so jump in and correct me here. But you talk about, I think it's a sexual journal. Is it
Yeah,
sexual journal? Yeah.
yeah, yeah. Sexual health
Um, Sexual health journal. So as you're working through the book, and I highly encourage everyone to go out there and grab a copy, you can start to kind of understand your own individual experiences when it comes to these things. So having these frameworks is really helpful, but it's all about putting it in your own context. And I love that you do that sort of at each step of the way. So getting people to understand, what are my own thoughts around this or my own beliefs around this, or what are my handbrakes or my accelerators. I think that people can get stuck thinking this is what someone else's experience looks like, or this is what I see on TV, or this is what I see on movies. This is the way it should be. And I hope that the conversation today has started to help shift maybe some of that for someone who's starting to see that, there are many different ways of experiencing pleasure, desire, sexual satisfaction, and it really starts with understanding myself. So I wanted to ask you, what are some of the things, if we just get super practical for a moment, if someone's listening and a lot of this is starting to make sense and they want to start to reconnect with desire in themselves and in their relationship, and they're maybe seeing this as a possibility for the first time. What's one small step that they can take, both in terms of themselves and in terms of the relationship?
One of the places we can start is just the relationship to pleasure as a whole. And that doesn't have to start sexually. If this is something that you are interested in exploring or not as in touch with, sort of what brings me pleasure? I don't know. That may not be isolated to sex. That may be sort of my relationship to pleasure in general. And so something that we can start off with is just getting curious, whether it's each day or once a week or, kind of exploring what are the things that feel good, that I like, that I feel drawn to, that I want to do more of. And so that could be, different sensations like, I like to shower with a certain temperature, a certain scented soap, or I like the taste of this, or I like the feel of the sunshine on my face. I'm going to go outside more. Just kind of giving yourself some permission and putting pleasure on your radar without pressure and expectation or judgment, but just sort of noticing what is this like for me? I feel drawn to this. Maybe I'm going to give myself more room to practice this more. So you can practice non-sexually. And then with sexually, I always think of, sexual, changes and when we're trying to kinda work on something that's sexually maybe not where you want it to be, I think of it as experimental. It's sort of a trial and error. Let's open up some possibilities. Let's try a few things on and just see what it's like. And it's okay if I like it and it's okay if I don't. And so that could be exploring different stimuli. Maybe it's watching, a streaming show that has some sexual content and just seeing like, how does it feel to watch this? What
Mm.
comes up for me as I watch this? Maybe it's grabbing a, popular book that has some romance and sex in it and seeing, what is it like for me to read this? And just without expectation or pressure to have a certain response, but to just see what's it like to read this, to watch this, to see this, and start there.
I love that, and I really wanna reiterate because I can hear when you're talking that this is for both partners, but I really
Mhm.
wanna reiterate that this is so important for the partner who's experiencing low sexual desire and the partner who's experiencing high sexual desire. So
Yeah.
really opening up that smorgasbord of
Yeah.
pleasure experiences.
Yes, yes, because for the higher libido partner, we want to also know what are the other ways that you experience pleasure, not just through maybe one or two sex acts, but as a whole, right? And how can you experience that for yourself? How can you experience that with your partner? So yeah, I appreciate you adding that. It's for everyone.
And so is your book. Like, I love the way that throughout the book you frame it for both partners. And again, we're not saying that, people sit in one camp or the other, but it is sort of understanding the experience that we might have from both perspectives in the relationship, which I think is so important. And unfortunately, not a lot of resources do that at the moment. So I really value the way that you do that throughout the book. In the book, you also mention intimacy dates. Can you talk a little bit more about what that is and how that might be different and maybe a little bit more helpful than scheduling sex?
Yeah. A lot of people, by the time they get to us, have tried scheduling sex, and it generally doesn't go very well, or at least for the folks who it's going very well, scheduling sex, I don't see those folks, right? Um, the problem, I would say, the challenge with scheduling sex is that we often already have kind of that staircase model expectation of what's going to happen. And typically that is intercourse for most partnerships, right? So when we think about scheduling sex, typically what we're actually doing is scheduling penetrative intercourse. And if you're somebody who has not been enjoying that as much, maybe there's pain, maybe that's not kind of the energy or bandwidth that you have for intimacy, that can start to bring a lot of negative anticipation, right? So if it's Monday, we're saying, okay, we're scheduling sex on a Saturday, you have how many days to just sit and think about, oh gosh, well, what if I'm not in the mood? What if something changed? What if I don't sleep well the night before, right? I've been having this health condition. What if that flares up when we are supposed to have sex? And then my partner's going to be disappointed. And you could already see the snowball rolling downhill of kind of worried thoughts about this, right? Desire in many ways requires positive anticipation, and scheduling sex often doesn't do that. So Lauren and I talk a lot in our book Desire about intimacy dates being kind of taking the best part about scheduling sex, which is the planfulness, because life is busy and there's always a reason not to connect, right? There are kids, there are work things, there are life responsibilities. There's always reasons why we might not spend time together with our partner. So, planfulness and scheduling to a degree can be helpful, but we don't plan what's going to happen until we get there, right? So we use the metaphor of kind of a restaurant reservation, right? If you are, talking to your partner on Monday and you're like, "Yeah, let's go out to eat Saturday night." We reserve a spot at that restaurant, right? But what we don't do is order our food before we get there. We wait until Saturday rolls around and we decide, okay, are we celebrating? Maybe we do the full, like, fancy four-course meal, right? Or maybe we have theater tickets after this, so we're just gonna grab a quick drink and get out of here. Or maybe, like, we're a little bit hungry, but we're just gonna, like, try a bunch of things, a bunch of small shared plates, right? You kinda see where I'm going with this.
Yeah, I love it.
We wait, and it depends on the context, right? We come back to what is that context, what information, what data is that context giving us? And we plan our intimacy and we plan what we're going to do in the moment based on that context, right? Not from 5 days ago how we were feeling.
Mm.
And so it does mean that we have to start practicing and working on communication about what we're interested in doing, what we're not. And that can be a skill that a lot of couples have to start practicing.
Absolutely, and you have so many great tips in your book. I know you weave a lot of the Gottman I'm certified in the Gottman model as well, so a lot of the Gottman communication strategies in there, which is super practical and, just easy to grab and use with your partner, so such a great tool to be able to access that. I wanna ask you while I have you, because we love to dispel myths here, and there is obviously a lot of myths when it comes to sex out there in the internet and social media or just the broader world. What are some of the myths that you've encountered when it comes to desire or pleasure or sex in general?
I think the first one is just assuming that spontaneous desire is how it works for everybody, right? Like that is that's not the new concept. Responsive desire is the newer concept for people to understand. Spontaneous desire is not that it's a myth that people experience that, they certainly do, but it's sort of a myth that that's just how sex works, and anything that deviates from that is dysfunction or disorder. And so, first and foremost, when we're talking about desire, we're talking about, that it is normal, healthy, within range to have a variety of experience around that. And that, there is no normal amount of desire that everybody should have. Um, there are people who don't experience responsive desire either, and that's normal and okay too. Really, it's the dynamic that evolves between partners that is more of the concern than the actual amount of desire you have.
Absolutely, and I think that can be a real shock to people, particularly, when we move out of that honeymoon period where even if we're naturally more responsive long term in a relationship, in that honeymoon experience, we are experiencing more of that spontaneous desire because we have all those lovely chemicals happening. And then
Mhm.
we shift into a more responsive desire experience and we start to question, is there something wrong with me? Or is this about my attraction to my partner? Is there something wrong with the relationship? So I think that understanding of responsive desire just really shifts that and not only our thinking, but also gives us a pathway forward towards more pleasure. And what about for you, Jennifer? Is there any particular myths that you would love to dispel for us?
Yeah, I think we come full circle back to what we started with, that this idea of matching libido with a partner is often not a realistic expectation, certainly not a realistic expectation for the long term, right? Every individual person has ebbs and flow in their libido. And then if we pair two people, three people in partnerships together, everyone's ebbing and flowing together. So to expect that we're going to match and match all the time is not a realistic expectation. That is the maybe Disney Hallmark version of expectations, but not what most people experience.
Absolutely. I also want to ask you, we love to end with this question on the podcast, and I'm sure you guys have some very interesting skills here. If you had a magic wand and could impart one piece of knowledge or skill on all humans, what would it be?
The thing that comes to my mind is flexibility. That this is a skill, a trait, an embodiment that is so universally helpful. It's helpful in relationships, it's helpful with sex, it's helpful with life. The more rigid we can get in a particular area, the more we tend to struggle. And so, certainly there's boundaries within this and limits, and we're not saying be flexible with every part of your life. But the more mental flexibility that we have, and as sex therapists, we certainly see this as quite an advantage for folks when they have more flexibility around their sexual experience and what they expect that relationship to look like over time with their both with themselves and their partners. That tends to lead to better outcomes than people who are, kind of grasping at some ideal version of their sexuality or an ideal version from when they were, 19 years old.
It speaks to me about what good collaborators Lord and I are, that my response in many ways, fits so nicely, right? So, in addition to flexibility, if I could kind of wave the magic wand, right, it would be really ensuring that folks understand that diversity in humans is the norm, right? Diversity is the
Mhm.
norm, not the exception. And I mean that in the most broad way for human people, right? But also specifically around sex and sexuality. Diversity is the norm, not the exception. People are into different things. They like and dislike different things. Libido is very diverse across our species. Diversity is the norm, not the exception.
I love both of those so much. I think if we could all be a little bit more flexible and understand diversity a little bit more, we would live in a very different world, a very more compassionate, kind, accepting world filled with love. So I love those both. Thank you so much. Thank you so much for your time. I just want to talk about your book for a moment because it is fabulous. I was reading through it and I was actually thinking I could have saved myself approximately $40,000 if I bought this book and I didn't do my master's of sexology. And I'm serious, like, you capture so much in there in, obviously such a succinct way. So I think for someone who really is very interested in research or concepts, it's fantastic. But also for people who are just wanting something more practical, as I touched on earlier, the way that you integrate the sort of the reflection throughout each piece of the book really helps people to understand themselves better, their context better, and, creates that pathway for pleasure and increased sexual satisfaction on the individual level. And there are also just so many tools, like so many practical tools in there, communication strategies, exercises you can do. So I highly recommend if you're listening to the podcast and this is resonating, go out there and grab the book because it really will help you start to move towards that direction of greater pleasure in your life. So thank you so much for your time. I really appreciate it.
Thank you.
Thank you so much.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.